I'm Dr. Langley. I'm here in Pine Ridge Family Medicine. And just the other day, we had a patient who was traveling across the country, wanted to check her blood sugar. I forget all the details, but she didn't know how to check her blood sugar. And I realized I don't have a video that I can refer her to. So that was a travesty. And I had to talk her through it. It was fine. But I'd like to talk you, gentle watcher, through how to check your blood sugar and some reasons of why you might want to check this and what are some basic normals. All of this, by all means, you should definitely talk about with your doctor if you have questions or concerns, but just to throw this out there so that you realize you don't know how to check your blood sugar, you want to, maybe you're with a diabetic relative or friend and you want to help them check their blood sugar, this is the basics. So what you need is something to stick them with, to get a little drop of blood, a strip, a brand new strip, usually in a little container like this. Try to keep it closed because they're kind of expensive and you kind of want to make them last, and if they get stuff in there, they won't work. So a little strip, glucometer, poker, and alcohol wipe. That's all you need. Not too shabby. So pick a finger that you haven't stuck recently. Clean it off with the alcohol wipe. This particular little needle sticker thingy, you pull out this, kind of give it a twist to arm it, to make it so that the needle can stick out. And then you put it on your finger, and then you press this button, and it's going to stick me and make me bleed. Ouch! Not that bad, though. So now I have a little drop of blood. I'm going to turn on my glucometer, put the strip in so that this tiny little space where the blood can go into is sticking out, and hold my finger up to it so I bleed right into it, and hold it in place until the glucometer tells me that I have enough blood there. And then it tells me my blood sugar. How cool is that? So not too hard. And I have a little bit of a hole in my body that I can clean off with alcohol wipe, put a little Band-Aid on if I want. All good things. So that's the basics of how you check your blood sugar. And most of the glucometers have a little way you can scroll through and see your past blood sugars. Maybe a little button that you have to push to release this little strip so you can throw it away. So why would you want to check your blood sugar? Sometimes it helps, especially if you're pre-diabetic or diabetic, give you an idea of what kind of foods you're eating and how they impact your blood sugar. And especially if you're type 1 diabetic, hopefully you've gotten lots of training in this and are really an expert in counting carbs and knowing how different foods affect your blood sugar. But the very basics is that when you eat, you pull sugars out from that food, and that's what gives you energy, and it travels through your blood to all your different cells, all your muscles and organs and everywhere. So that blood sugar is traveling in your blood, and your body has to have a way of telling those muscles and organs to pull that sugar out of your blood to use it. So that's what insulin does, is insulin tells your body to pull the sugar that's floating around in your blood into it to use it for energy. And then there's another hormone called glucagon that's not as commonly talked about with insulin, but just thought I'd throw that out there. But you store sugar in your liver for long-term use. So if you've been going a long time without eating, your body releases glucagon from the pancreas as well, and it tells the liver to release more sugar from that stored form into your bloodstream so that you get higher sugar. So your body has ways to increase and lower the blood sugar and tell your body to use more of that sugar or to release more of it because the body needs more. So the basic numbers that can guide you as to being too high, too low. Hypoglycemia, which is too low of blood sugar, is really worrisome in the picture of being on diabetic medications, especially insulin, but a lot of injectable or oral pill type insulin medications can make your blood sugar get too low, which is a problem because you get some awful symptoms from being low and can even be a danger to yourself. You can even die from having too low of blood sugar. So that's a big concern for diabetics. Symptoms like having trouble remembering, being confused, having even heart palpitations, visual changes, just acting weird. Should prompt you, if you know that you've got a diabetic right there and they're doing those things, give them a sip of juice if they're conscious enough. Or they even sell little strips, little like goo of sugar that you can just put on someone's tongue and it'll seep into their bloodstream and you can save their life. But generally, just having a blood sugar less than 55 for an average person is considered too low. Obviously, that'll be a little bit tailored to different people with different diabetic situations. But in general, less than 55 is too low. And if you're being diagnosed with diabetes or trying to figure out if your blood sugar is getting too high, generally anything over 200 is considered at high risk for having diabetes, meaning that your body isn't using this insulin properly, whether it doesn't have the insulin because you're type 1 diabetic or because your muscle and organ cells aren't responding to insulin. They're insulin resistant, like they aren't responding to it like they should. They're not pulling the sugar from their blood like they should. That's type 2 diabetic. So that means your blood sugar is getting too high. It's the insulin isn't there, or the insulin isn't having the impact on the cells that it should, and so you're getting too high of sugars. That's the basics of diabetes. And so if it's just a random sugar that's more than 200, that's concerning. And if you haven't eaten anything with calories for 8 hours, which is considered fasting, anything more than 126 or higher is considered concerning for diabetes. So that's some basics of how to check your blood sugar and the very, very basics of how type 1 and type 2 diabetics are having problems with their blood sugar system. I hope that's helpful. If you have other videos that you want to watch, I would recommend that one. I think that would be a good one. And if you will subscribe, please, to our channel here at Pine Ridge Family Medicine, you'll get notified when we have new videos, and we like to see you. Thanks for watching.